qualified forensic psychologist. So I'm just at the end of that kind of route. As you said, I currently work for a company called Elysium Healthcare, and that's a private healthcare company. So we are not funded by the NHS, but we have NHS patients that might come into our services at different times. So Elysium is a company that has a very, very wide range of services, both inpatient and outpatient, as well as a variety of levels of security, all the way from community placements up to medium secure services. So we have kind of mental health services, more like general mental health services. We have kind of eating disorder services, learning disability and autism, more neurological and brain injury services, and then also the child and adolescent services that we've heard about before. So there's a massive range within the company, and there's places throughout the country as well, which is really, really helpful. And I'd kind of, like was echoed by Melissa, those early experiences are really, really useful. So my current placement, the current place I work in, is a female complex care unit. So it's quite a specialist unit. There's not very many of them around. So there's only 10 patients, all inpatients where I work. And they often have high levels of risk, high levels of presenting risk, but are cared for within a locked rehab kind of secure setting. So that means that there are locks on the doors and the ladies cannot leave freely. However, we work in a least restrictive practice kind of manner. So everything is individually risk assessed for each patient. So like Melissa was saying, part of my role will be to complete those risk assessments, see what we feel is safe for these patients and what we think might cause harm to themselves or others. And that will be done based on formal risk assessments, which I'll think about later, but also as part of a multidisciplinary team. So talking to other disciplines such as occupational therapy, psychiatry, nursing, all of those different things. So I thought for this presentation, I'd kind of go through my journey. So if we can go to the next slide, please. I'll go through my journey of how I got to where I am at the moment, and then start thinking about some of the challenges and some of the really great benefits that I've kind of noticed throughout my journey. And like Melissa was saying earlier, it is definitely a very challenging work environment, or can be, but actually the rewards are really, really massive. So in terms of my journey, I started by doing a psychology and criminology degree at undergraduate. This was 4 years because I did a sandwich year. So that means that I did my first 2 years, and then the third year I was working full time, and this was in a medium secure service in another private company. And I worked as a healthcare assistant with individuals with personality disorders and learning disabilities. And this was a male service. And within that, I also worked on the autism ward, which is also a medium secure. So that was really interesting in kind of piquing my understanding of what kind of psychological treatments are already done, what things we can offer, how we can help these patients. I kind of always knew I wanted to go into psychology because I didn't want every day to be the same. I'm someone who can get bored quite quickly, so I didn't want a standard kind of 9-to-5 job, and psychology seems to suit me very well from that. And from my early experiences, I've noticed that actually each day is novel and interesting, and you come up with different kind of situations to problem solve and have different positive experiences as well. So I was really lucky in this placement year that I worked on something called a therapeutic community ward, which is kind of it's a living learning environment. So therapy is done as a whole ward, which is quite unusual for inpatient services. This is usually done within some prisons. So prisons like Dovegate, Grendon have these things called therapeutic communities, and they've shown really, really positive outcomes for men within the prison service. So we ran a pilot study in a medium secure learning disability service to see if that would be effective, actually if it was beneficial for the guys on the ward. And actually we found that most of the guys although they initially struggled with it, obviously it's about being open and talking about difficulties with a bunch of people that you wouldn't ordinarily live with or want to complete therapy with. But actually, over time, the guys were really honest, really open. They had a lot of compassion for each other, and you could start seeing them taking control of their own lives and understanding, oh, okay, this is maybe where I have difficult thought patterns, or this is where I need a bit more support. And they kind of really bounced off each other. It was very interesting to see how they learned from each other, and that peer support was really, really useful. So I continued to work at that service as I went through my master's. So I did a forensic psychology master's to help me progress towards my route of becoming a qualified forensic psychologist. And that was the stage 1 BPS that you will have heard of. Something I forgot to mention that I should quickly mention in terms of if you are wanting to be a psychologist of some sort, most qualifications require a BPS accredited undergraduate. So just something to be mindful of when you apply for jobs. So once I finished my master's, I went on to work as an assistant psychology support worker, and this was in a residential school. So up until this point, I had only ever worked with males. So this was a very big career change for me. And actually, I found that I really, really enjoyed it. So I worked with young people who had autism and learning disability, in supporting them in a home environment and also bringing them to school and supporting them in that setting as well. My main role was caring for one specific young lady who had really complex mental health difficulties, and kind of supporting the psychological team as well as the support staff on the unit working within her home, to kind of bridge that gap and teach them skills that might help them work with this young lady, but also feedback information to the psychology department so that can update their treatment plans and where the risks lay, so what things they needed to start thinking ahead of. So this kind of supported me to start putting that risk hat on and thinking, okay, what are the risks in this area? What are the treatment goals? And help me to start work within that kind of multidisciplinary team, start working with a range of different professionals. I then got a job as an assistant psychologist, and that was in a mixed locked rehabilitation unit. So that was with males and females. So again, first introduction to working with adult females. So I feel like I've had quite a nice broad understanding of lots of different service users within kind of mental health services. Again, this was really, really helpful. That was my first proper assistant psychologist role. And again, really getting into those meaty risk assessments, starting to deliver some low-level interventions with service users, helping them manage with kind of early anxiety symptoms and things like that. I then got my forensic psychologist in training role, which, as I'll go on to later, are really, really challenging to get sometimes. And that was when I started working exclusively with females in medium, low secure and psychiatric intensive care unit as well. So in my current role, I've moved around slightly, which has been really helpful. So I've worked within a female medium secure service. I've worked within the female psychiatric oh my God, PICU, the psychiatric intensive care unit. And I've also been lucky enough to work in different hospitals within Elysium to help me gain that experience. So at present, I'm working in a male brain injury service, delivering an intervention with their psychology team in that hospital. I'm also working in another hospital on a low secure ward with some females and males doing ad hoc risk assessments and supporting other psychological departments. So within Elysium, where possible, we try to work across the region to kind of help support if there's any areas that other psychology departments are maybe having difficulties, they don't have staff in to deliver interventions, or they need somebody with specific expertise to deliver risk assessments. We kind of work along with that. So once I got the forensic psychologist in training role, I was able to pick which course I'd like to do. So if we go to the next slide, I can talk a bit more about those. So to become a forensic psychologist, there's two main routes to qualify. More recently, there have been more routes that have been developed, but I'd have a research and see which one suits you best. The two biggest ones out there are the BPS route to qualification, which many people may have heard of. So the Forensic Psychology Masters is seen as stage 1, and then the BPS route to qualification is seen as the stage 2 of that qualification. So this can be done anywhere between 2 to 4 years, and they have specific intakes. It's a very structured course. There's been lots of changes with the BPS more recently, so I definitely keep an eye on what that structure looks like. I know there's been, over the last 2 years, there's been a lot of changes within that. But within the BPS route, you get a registrar, a designated supervisor, and you also do individual pieces of work to complete core roles, and they can be supervised by lots of different professionals as well, and that helps you get the breadth of understanding of all the areas that you need. I went on to choose the Cardiff Met. Oh, sorry, can we go back on? Sorry. I went and chose the Cardiff Met unit, which was relatively new when I picked it. But this is anywhere between 3 to 5 years. It's a more flexible route. So I set my own deadlines, what work I'd like to do. So within the course, you do things such as conducting your own research, doing a consultancy project, showing your understanding of interventions, of developing formulations, doing assessments, all those kind of things, which you would also do with the BPS. But with the Cardiff Met route, you get to choose in which areas, at what times you'd like to submit each of them within that 3 to 5 years. So I found it a bit more flexible, and I found that worked for me, especially at a time when the BPS were maybe going through changes. But I also worked with another trainee who actually found the structure of BPS suited more to her individual needs. So again, I'd really have a look through what each course offers and how you work as a person. If you need those strict deadlines, maybe the BPS might be a bit more useful for you. Whereas if you're good at planning your own deadlines and setting your own time, Cardiff Met might be useful. The only thing to mention with Cardiff Met was I also found that you got more contact. So I have an academic supervisor at the uni as well as a clinical supervisor, which is different to BPS. With Cardiff Met, you don't get chartership, which for some people is an issue, but that doesn't impact your practice anymore in terms of getting a job or a role as a forensic psychologist. Can you go on to the next slide? Thank you. So some of the biggest challenges that I've had to overcome within this role has been the time taken. So I graduated about 10 years ago now, and I'm only just at the end of my qualification journey. So it definitely takes a lot of time. And part of this is because of that, maybe rejection might be a bit too strong of a word, but it's really, really competitive. As Melissa was saying earlier, getting those roles can be really, really competitive. There's lots of people applying for not very many roles. So sometimes I felt a little bit disheartened in terms of I'd applied for lots of assistant psychology roles and was only hearing back for some of them, and that can be really challenging. But then once you do get the role, you start that ball rolling and you start getting into that field and gain all of that experience, and that's where that early experience that Melissa was talking about earlier is really, really important. We work with really, really challenging populations. So as one of the questions was earlier, that looking after your own mental health and your self-care is really critical, and that might be through things such as reflective practice or group supervision, peer supervision, your individual supervision, speaking to your colleagues within your department as well as ward staff, and doing things that take you away from work and give you a bit of me time, whatever that might look like for you. Some of the other challenges are in terms of the relationship dynamics within the unit. So obviously you're working with complex patients, which can cause people to kind of have quite heightened emotions. You're usually working within a large team, like I mentioned earlier, in terms of occupational therapists, psychiatrists, speech and language therapy, nursing team. And sometimes they might have different views on how to treat the patient in front of you, and sometimes that can create some challenging dynamics. But again, that's a really great opportunity to start understanding how to be diplomatic, how to use research to help you understand, oh, okay, actually as a psychological practitioner, this is what I can offer, but actually maybe psychiatry need to help with this, maybe occupational therapy need to help with that, and it kind of helps you to build that structure. Next slide, please. So some of the greatest things about all the roles that I've had, the biggest one is definitely the service users. Like I said before, I wanted a role where Every day was going to be different, and the variety of service users I've worked has definitely made that possible. I've met some amazing and strong people throughout my journey. Obviously, there will be challenges within that, but I think watching the journey of people go through services, specifically within inpatient services, of having people come in that might be quite unwell, have a lot of life difficulties, helping them understand that through psychological therapies, through all of the input and support that we give them, and then watching them be discharged back into the community is an absolutely wonderful feeling. Melissa spoke about the wealth of experience that you get as a psychological practitioner. It's exactly the same with a forensic psychologist. We get to work with a variety of different people. Like I mentioned earlier, we've also got lots of different risk assessments that we might do. We might give reflective practice to the staff team to help understand the specific patients or service users that we're working with, help them manage their mental health, and how that burnout that might come with working with such complex patients. And again, working within that multidisciplinary team as well gives you that experience. In line with this, I've also had a lot of ongoing support. So like I said before, where I work within Elysium, I've been able to work across lots of different units with lots of different difficulties and challenges presented by service users, and that's helped me to develop competence in lots of different areas. So now I know that actually I'm able to work with children, with males, with females, with brain injury, with personality disorder, and I've got a little bit of understanding of all of these things, and that's really useful when I meet somebody new to help start developing that formulation of how their life experiences might have impacted where they are today. And again, alongside that, I've also managed to work with lots of different types of psychologists, which again have opened my eyes to the different views of service users. So as a forensic psychologist, I might sort of be looking at the risk assessments, how we can manage that, what kind of treatments we might be able to offer. But I've also worked alongside a counselling psychologist who views things very, very differently and kind of uses a lot more imaginative ways than I would ever have imagined. And again, we can work together and weave our ideas together to make a more robust treatment plan for our service users. Okay. So that's a whistle-stop tour of where I am and how I got here, and hopefully that will be helpful. But yeah, does anyone have any questions?